Hi, my name is Annie, and today we're going to be talking about diabetes. Diabetes is the inability to produce or respond to insulin. Diabetes it impairs your circulatory system, which means it affects every part of your body. So the longer you have diabetes, the more complications you can have. It is also the number one cause of non-dramatic amputation due to necrosis. There are two types of diabetes: type 1 and type 2. Type 1 is the deficiency of insulin, while type 2 is the lack of insulin or resistance to insulin. Right now, globally, there are estimated 422 million people diagnosed with diabetes. Of that number, 321 is in the U.S. alone. That number is rapidly increasing. Genetically, the cause of type 1 diabetes is unknown, although the major risk factor is due to obesity and the possibility of inheriting it from both of your parents. For type 2 diabetes, it is mostly due to environmental factors as well as lifestyle choices. In 2012, there were the people between the ages of 45 to 64 was the biggest age group diagnosed with diabetes. So the older you get, the more risk for diabetes to become. Originally, women were more prone to develop diabetes, but right now the number is beginning to become equally prevalent among both men and women. As for type 1 diabetes, Caucasians are most at risk for developing it, and it's mostly due to the possibility of inheriting risk factors from both parents. For type 2 diabetes, ethnic minorities such as African Americans, Asian Americans, and Mexican Americans are more prone to developing type 2 diabetes due to obesity and a sedentary lifestyle. The CDC has identified a diabetes belt, which consists of 15 states and 644 counties. And if you look at that, it's mostly due to the southern states, and in that, within the diabetes belt, 11.7% were diagnosed with diabetes, while outside the belt, it was only 8.5%. Thank you.
Hi, my name's Casey, and I'm going to be telling you about the relevance of knowing about diabetes in general. The most relevant type of diabetes to be aware of is type 2, especially with this day and age in our lives at the moment. The most important thing to know is that you want a healthy diet and you want to live an active lifestyle. You don't want to have a sedentary lifestyle where you eat fast food every day, 3 meals a day, and you sit on the couch and watch TV all day, because that will not help you. As well, I'm going to be telling you about the clinical manifestations of type 2 and type 1 diabetes. Type 2 and type 1 have very basic, similar clinical manifestations, though type 1 is acute, whereas type 2 is more of an progressive onset. And so the three main clinical manifestations are polyuria, polydipsia, and polyphagia. So large amounts of urine, excessive thirst, and excessive hunger, respectively. As well, with type 1 diabetes, there is weight loss, weakness, and fatigue. Risk factors related to both sets of diabetes. Type 1 is genetic based, and you're predisposed, and it's a relation to the human leukocytic antigen. Whereas type 2, there's a lot more risk factors, including obesity or being obese, being older. So whereas in type 1, usually happens in younger people. Type 2 happens in older people as they become more sedentary in their lifestyle, as well as having a family history of type 2 diabetes. As well, type 2 diabetes also affects more ethnic cultures. So African Americans, Asian Americans, Hispanics, Native Americans, Native Hawaiians, and Pacific Islanders are at greater risk of developing type 2 diabetes versus whites. Thank you.
Hi guys, my name is Stephanie, and today I'm going to be discussing the diagnostic testing for diabetes, complications of diabetes, and whether or not diabetes is contagious. So to start off, the diagnostic testing for diabetes could be a non-fasting blood glucose, which means the patient has had something to eat, and if it is greater than 200, that indicates diabetes. We can do a fasting blood glucose, which means the patient has not had anything to eat for the past 8 hours, and anything greater than 126 indicates diabetes. Lastly, for an already diabetic patient, we can we can perform an A1C test, which is basically a measurement of the amount of glucose in hemoglobin, and it's represented as a percentage. It can provide the measurement of the glucose from the past 2 to 3 months, and if it's higher than 6.5, that indicates diabetes. Some complications of diabetes include adult blindness, end-stage renal disease, and also non-traumatic lower limb amputations. Diabetes is a major contributing factor to heart disease and stroke. Other complications include diabetic retinopathy, diabetic neuropathy, cataracts, glaucoma, hypertension, coronary artery disease, and these patients are also at a higher risk for infections. Adults with diabetes have heart disease rates 2 to 4 times greater than adults without diabetes. Their risk for stroke is also 2 to 4 times greater than those patients that don't have diabetes. And lastly, half of patients that have diabetes also have hypertension or elevated cholesterol levels. Lastly, diabetes is not contagious. Research suggests that type 1 diabetes is mainly caused by genetics, and sometimes it's also related to environmental factors, whereas type 2 is mainly related to nutrition and whether the patient is obese and also their exercise activity.
Hello, my name is Alexis, and today I'll be talking to you about the preventative strategies for diabetes mellitus, the treatment and the goal of the treatment, and the financial burden for the patient, the family, and the community when it comes to diabetes mellitus. First, we'll start off with the preventative strategies. With type 1 diabetes, there is no preventative strategies because of the fact that type 1 diabetes is due to a genetic factor that you can't prevent. With type 2 diabetes, the main thing that you need to, in order to prevent diabetes type 2, you need to increase exercise and physical activity. With type 2 diabetes, there is a decrease in insulin production, or there's an increase in insulin resistance because of a sedentary lifestyle. So obesity is a main risk factor for type 2 diabetes. So it is important to maintain a healthy weight. If you are overweight, to lose the appropriate amount of weight, to have regular, consistent exercise, and to choose foods that are low in fat content, total calories, and processed foods, and that are high in whole grain, fruit, and veggies. Obviously, if you are overweight and you're over the age of 45, it is important to get screened. Treatment and goal of treatment, there's 3 main types of treatments for diabetes mellitus, type 1 and type 2, which is drug therapy, nutritional therapy, and exercise therapy. With drug therapy, this occurs with type 1 and type 2 because of the fact that with type 1 you require exogenous insulin to survive, which you'll need multiple injections, usually via an insulin pump. With type 2, it's a progressive disease, so you may need insulin with also a combination of the nutritional therapy, exercise, oral and non-insulin injectable agents such as biguanides and sulfonylureas, and other non-insulin injectable agents. With nutritional therapy, as I mentioned earlier, you want carbs that are from fruits, vegetables, grains, maybe low-fat milk. The amount of protein in diet is usually individualized, but if you're trying to lose weight, high protein should be avoided. You want to minimize trans fats. You want to monitor your cholesterol, and fat-soluble vitamins A, D, E, and K are highly important. Also, if you are drinking alcohol, it is important to drink a moderate amount, not an excessive amount. With exercise therapy, moderate exercise is perfectly fine. It just needs to be regular, consistent. There needs to be a warm-up and a cool-down period, and it's best done after meals. The goal of treatment is to maintain a blood glucose level that is as normal as one can achieve. It's also important to maintain a good lipid profile, to monitor your blood pressure, to prevent or decrease the risk of CVD, and just to maintain to where complications that were mentioned earlier in this video do not occur. So some financial burdens that can occur to the patient, the family, and the society is mainly because since diabetes mellitus is a progressive disease, there is usually a recurrence of hospitalization for the patient throughout their lifespan. this can also, because of the medical costs, that is a problem. The complications that occur with diabetes, such as amputations, vision problems, neuropathy, that also, and circulatory problems, also can place a financial burden, along with insulin, payments for insulin, since it's a lifelong disease. Thank you.
Hi, my name is Laura Fox, and I'll be talking about rehabilitation services for long-term care for diabetes. There's no rehab for diabetes because it is a lifelong disease, so all you have to do is maintain it, and to maintain it, you must focus on your diet and exercise and insulin therapy as well as drug therapy. So regular appointments with your doctor are crucial. If you don't maintain the disease, your body will suffer. Your organs may shut down, your kidneys may fail, and you may be required to be on dialysis later in life. So it's good to maintain it for as long as you can. You must get regular A1C checkups as well, because just checking your blood sugar won't say exactly how much your body's really being affected. So regular weight A1C for a normal person is below 5.7%. For a diabetic, it's above 6.4. If you're in between that range, between 5.7 and 6.4, you're considered pre-diabetic. So emotional and spiritual effects. So emotionally, diabetes can be hard to accept because it is a lifelong disease. People may not have necessarily signs, and they think, oh, I can keep eating the way I'm eating, keep doing what I'm doing, and I'll be fine. But it will hurt your body later on. So that can be hard to accept because it is lifelong, and you will have to change your ways if you aren't used to exercising or eating properly. And spiritually, depending on what your faith is, you may ask, like, why me? Why do I have this? Like, no one else has this. And so you can maintain it like your faith. You know, you have to read the Bible every day and go to church every Sunday. You'll have to go to appointments frequently and watch your diet and check your blood sugar daily. So support resources for individuals and families for that. There's online resources. You can go to diabetes.org, and they have plenty of information there. Or you can ask your regular care physician for reference to an endocrinologist, and they can better understand the disease for you because they can get way more in depth with what you actually need to do, and they'll check more specifics in your body, and they'll be able to help you better than your regular physician would. There's also support groups all over the community. We even have one here at Houston Baptist University at the Bradshaw Fitness Center. We have like a diabetes group that meets, I think, the first Friday of every month. So they're out there. You just have to look for them, and you can even ask your doctor for references to that.